Few things are more welcoming than a bright smile. Here at Integrated Dentistry, wellness means taking care of your teeth, your mouth, and your whole life. Today we're talking to Dr. Derrick Johnson about his unique approach. Derrick, tell us about integrated dentistry and what makes your office different from the typical dental office.
Well, we do offer, all the general services that you would expect from a dental office, but there's just certain areas that we kind of go a little bit beyond that, and we help people solve more complex dental problems. We definitely take a very customized approach. So this isn't a place where there's going to be, 50 people I'm trying to see in an hour and I'm running chair to chair to chair. It's more one-on-one, customized treatment plans.
And you have a philosophy that drives that.
Yeah, definitely. There's several elements of that, but one is, we know the mouth is just a central part of who a person is, from a health standpoint, from a self-esteem and confidence standpoint, from how other people see you, how you see yourself, and also just from an aging and longevity standpoint. I mean, your teeth play such a huge role.
Yeah, so instead of just dealing with teeth problems, you're dealing with a whole mouth, you're treating the mouth as a whole system.
Exactly. And so, yeah, I mentioned that big word, stomatognathic system, right? So stoma means mouth, and gnath, that refers to your jaws or chewing. So if you can imagine the mouth-jaw chewing system. And so when we look at it in that way, there's just a lot more that can be accomplished. We can really get to the roots of problems, because there's so many dental problems that are actually rooted in a bad bite or other things going on. And the bigger picture that we can look, the bigger the impact and more predictable results we can get.
Give us a couple of examples of ways that you've treated someone and dealt with their issues from a systemic point of view, and the kind of impact that's made for them.
Yeah, one of the things we'll commonly see is people will come in and they'll have, they'll notice that their teeth are really wearing severely or wearing unevenly. And then they'll mention that they have headaches, or their jaw's tight, or they wake up with headaches and they're clenching their teeth. And a lot of people don't realize that those symptoms are directly related to their teeth, bite, and chewing system. Yeah.
What's the process that someone goes through when they come in as a patient? You mentioned that it's not just herding as many people through as possible. You take a very customized approach. What's the process like? What's treatment like typically for one of your patients?
Yeah, I'm glad you mentioned that, because that's really where the fundamental difference is. There's no way that I can help people with these types of issues by doing 5-minute exams when they're getting their teeth cleaned. I really need to spend some more time with them, and the first couple of appointments are really some of the most important. We do the necessary films, I do a comprehensive exam, I do some photographs so I can see what's going on, and also, just as important, so I can communicate what I'm seeing, because I want everybody, a lot of times what I'll hear is patients will say, oh my God, this is the first time I really even have seen this. And so I really want my patients to have a really good understanding of their situation, what their options are, and so we can guide them through it and get them the results that they want.
Yeah. This is personal for you. You told me before about when you were in dental school. Tell us that story.
I remember when I was a kid, my mom had some issues with her teeth. She had some issues with her gums, and she was referred to a periodontist. And I remember it really kind of lit a fire for her. She was going to get her mouth healthy, and every 3 months she went to the periodontist, and I would go with her. And I really watched her get herself healthy, like take control of her health. And so my mom, like today, she's 75, 76 years old. She has all her teeth, a beautiful smile, and she's really this dental success story that I got to watch as a kid. And I think that influenced me in maybe going this direction. Mm-hmm. My dad, however, is a very, very different story, okay? So he When he was a kid, he had a very bad dental experience. So this is probably like back in the 40s, right? And things were very different back then. And he basically vowed to never go to the dentist. And he kept that and literally never went to the dentist his entire life until I was in dental school. And I talked to him every week by phone or whatever. And I said, hey, Dad, I really need to, in order to get my requirements met, I need to do some dental exams. I said, would you come in for an exam? And I couldn't believe he actually said he agreed to do it. Because this was like the first time he'd be at the dentist in decades. So anyway, he came to the dental school, I gave him a tour around, and then it came time for his exam, and it was tough for me. It was literally, his mouth was a disaster. And it was probably, at that point in my young career, that was probably the worst dental disease I'd ever seen. And I had to break the news to my dad that he needed dentures. And the first set of dentures I made for anyone was for my dad.
Wow.
And to get him through that experience, was really having to deal with somebody with some pretty extreme phobias. So it's I know what that's like for people. And so I really wanted to build an environment that can give someone a different experience, a positive experience. And so we do that in a lot of ways. I think the main way is communication, but we have nurses here, we do IV sedation, we have several different levels of sedation depending on what somebody needs and the type of treatment that they need. But anyway, we cover that subject thoroughly because it's very important to me.
Here at Integrated Dentistry, Dr. Derrick Johnson and his team will make sure that it's more than just your teeth that are going to change. Derrick, thank you so much.
Hey, thank you, Rob.